Hello friends, myself Dr. Palaniraman, a practicing pediatrician from Tamil Nadu. Today's topic for discussion is an important clinical sign, that is cyanosis. Cyanosis refers to bluish discoloration of skin and mucous membrane secondary to increased deoxygenated hemoglobin or abnormal non-functional hemoglobins which are increased like methemoglobin or sulfhemoglobin. Where should one look for cyanosis? Cyanosis should be looked for in the mucous membrane like buccal mucous membrane as well as tongue, as well as in the skin where the areas of the skin which is thin as well as stretched out. For example, tips of the fingers, tip of the nose, ear lobules and lips. What are the factors which can affect the visibility of the bluish discoloration? Number one, lighting. For example, cyanosis is best visible during the daylight. Number two, the color of the skin as well as skin thickness also affects the bluish discoloration. For example, a patient with a normal hemoglobin, when there is saturation of less than 80%, cyanosis will be visible. Whereas in a dark-skinned individual, the cyanosis will not be visible even up to the saturation of 70% because of the darkened skin. But the cyanosis in the mucous membrane or the tongue is not affected by this factor. Next important factor which can affect the cyanosis is the percentage of hemoglobin. You need an absolute percentage of reduced hemoglobin more than 5 grams percentage in the capillary blood to produce cyanosis. So whenever the percentage of hemoglobin is less, like in anemic patient, for example, a patient with anemia with a hemoglobin of less 6 grams or so, to get a reduced hemoglobin of more than 5% is next to impossible. So in anemic patient, the cyanosis may not be obvious majority of times. Whereas in polycythemic patients, the cyanosis is most often easily visible even with a less amount of desaturation. So only when assessing a hypoxic patient, it is important to measure the fingertip saturation rather than relying upon the cyanosis because of these fallacies. Now coming to the types of cyanosis, there are two important types, central as well as peripheral. We all know in the peripheral cyanosis that only the peripheries or the extremities are cyanosed like fingertips, palms and soles, tips of the nose, malar prominence and the ear lobules. Whereas the mucous membrane as well as the tongues are not bluish. In central cyanosis, both the mucous membrane and skin are bluish in color. The basic mechanism under central cyanosis is decreased arterial saturation leading to increase in the reduced hemoglobin or increase in the amount of non-functional abnormal hemoglobin. This is the basic mechanism in central cyanosis. Whereas the mechanism in peripheral cyanosis is mainly a poor blood flow and stasis of the blood flow leading to increased extraction of the oxygen leading to reduced hemoglobin and cyanosis. So like conditions like shock or poor congestive heart failure where there is a poor capillary blood flow and leads to a peripheral cyanosis. So these are the basic mechanisms of central and peripheral cyanosis. Now let us dwell upon what are the causes of cyanosis. Now coming to the causes of the cyanosis. To start with, central cyanosis, as we have already told, it is mainly due to increased deoxygenated hemoglobin or increased abnormal hemoglobins. Increased deoxygenated hemoglobin can be due to, first of all, from the atmospheric air containing less oxygen, as in high altitude areas like Ladakh, as well as whenever there is a fire accident with a lot of smoke and we inhale the air with less oxygen, finally leading to arterial desaturation. When coming to inside the body, any cardiopulmonary conditions, to start with the pulmonary conditions, starting from the upper airway to the lower airway to the parenchyma, as well as the pleura or the diffusion across the membrane, any pathology can produce respiratory compromise and decreased arterial saturation as well as cyanosis. The cardiac conditions mainly the shunts, right to left shunts like cyanotic congenital heart disease, as well as pulmonary AV fistulas, multiple intrapulmonary shunts can produce cyanosis. Abnormal hemoglobins, even though a rare cause, can cause cyanosis. For example, methemoglobinemia, which can be congenital or acquired. Acquired methemoglobinemia may be mainly due to drugs like dapsone as well as nitrates can produce increase in the methemoglobin content and producing cyanosis. Sulfamethemoglobinemia also, like mainly whenever any sewage worker is exposed to abnormal gases containing lot of sulfur, can lead to sulfamethemoglobinemia and cyanosis. What is the basic mechanism in peripheral cyanosis? Central cyanosis is always pathological, whereas peripheral cyanosis can be physiological or pathological. Whenever a person is exposed to cold, severe cold, the extremities, the vasoconstriction happens, and because of the poor blood flow and stasis, you can get cyanosis in the extremities, which is a physiological one. It is also known as acrocyanosis, which is common in newborn. What are the pathological conditions causing acrocyanosis? They are whenever there is arterial occlusion in the form of vaso-occlusive disease in the form of Raynaud's disease, or veno-occlusion in a deep vein thrombosis. In both the condition, there is a decreased blood flow as well as venous stasis and increased extraction of the oxygen, leading to increased reduced hemoglobin and cyanosis. So these are the conditions causing peripheral cyanosis. Okay, after knowing the causes, now let us see how to approach when a patient comes to you with cyanosis. First of all, is the cyanosis present? I know where to look for, number one. Number two, I want to know whether this patient is a central cyanosis or having a peripheral cyanosis. What are the differences? In peripheral cyanosis, only the peripheries are blue, whereas the mucous membranes are not blue. Number two, the peripheries are cold. Number three, warming the peripheries will lead to disappearance of the cyanosis. Number four, oxygenation will not alter the peripheral cyanosis. These are the difference between the central and peripheral cyanosis. After knowing that I am dealing with the central cyanosis, the next important thing is what is the age of the onset. Younger the age of the onset is more common you are dealing with the cyanotic congenital heart disease. After the age of the onset, next comes the acuteness of cyanosis. Most of the respiratory conditions, both in the children and adult, are acute with cyanosis, but cyanosis is a very late manifestation, and usually they are in respiratory distress. Whereas cyanotic congenital heart diseases, as well as chronic lung conditions like COPD and interstitial lung diseases, are conditions without distress, but usually they will be accompanied with the clubbing, which is an important feature. After you have fixed both cardiopulmonary conditions and you are not able to find out the cause clinically as well as by X-ray, ECG, echo, and you are not able to fix the diagnosis, you should think about abnormal hemoglobins. Here there is a very good clinical clue. There is an dissociation between the fingertip saturation and ABG. The fingertip saturation will be low, but whereas the ABG or PaO2 will be normal, which gives a clue that you are dealing with the abnormal hemoglobins, which can be confirmed by spectroscopic examination of the blood. So this is the way one should go across when approaching a patient with cyanosis. Now comes the different terms. A differential cyanosis. For example, when the upper limb is pink, lower limb is cyanosed, we should think about differential cyanosis. Usually in small babies with severe coact or interrupted aortic arch, or in older individuals with PDA with shunt reversal, you should think about differential cyanosis. What is reverse differential cyanosis? Here usually the lower limbs are pink, upper extremities are blue. This occurs in conditions, the previous conditions when they are along with the PGA, they have a reverse differential cyanosis. Another important terminology is known as pseudo-cyanosis. Here there is no true cyanosis, but there is abnormal bluish pigmentation of the skin due to bluish pigment deposition in the skin when the patient is taking drugs like amiodarone in adults where there is malar prominence with bluish pigmentation. As well as when they are taking silver salts, the condition known as argyria, they can have a bluish pigmentation. In a small babies with Mongolian spots or large birthmarks, they can also mislead as cyanosis. Friends, now hope you should be very clear with what is cyanosis, where to look for cyanosis, what are the important types of cyanosis, how to differentiate a central from peripheral cyanosis, what are the important causes, and how to approach when you are encountering a patient. Thanks for watching this video. Please keep tuned for the steer videos for a continuous learning. Thank you one and all.